Welcome back to this Medical Monday on Great Day Washington. Time for round 2 of Medical Hot Topics. We're back with orthopedic surgeon Dr. Eric Guidy and podiatrist Dr. Damian Roussel from the Centers for Advanced Orthopedics. All right, we want to continue our conversation about foot pain and things that we have learned, especially when it comes to diabetes. So those with diabetes, what are you seeing in terms of how that affects maybe foot pain and disorders that they suffer from?
Well, with diabetes, the risk is that chronically high blood sugars put patients at risk for infection, cause a small vessel disease where they are not able to heal things as well, and can cause neuropathy where they can't feel their feet. And so when you combine those three, in the worst case scenario, patients can step on something, get a break in the skin that they don't feel, have difficulty healing it because of the small vessel disease, and develop infections that other patients may not develop because of their chronically high blood sugar.
I saw this stat from 2006 to 2010, more than 1 million patients went to the emergency department for diabetes-related foot complications. So how does somebody with diabetes prevent that and keep, that self-care, so to speak?
From the standpoint of preventive maintenance, they need to try to chronically keep their blood sugar under control. They need to have a good regimen and good communication with their primary care doctor. They need to be seeing their primary care doctor regularly and taking off their socks and shoes and having them look at it. They need to be seeing a foot specialist regularly as well, like a podiatrist, to commonly evaluate their feet and make sure that nothing's getting missed. But they need to, have a good regimen with their primary care doctor as far as medication and diet to figure out what scenario works best for them to control their blood sugar.
So those with diabetes have to be concerned about that, but also obesity increases foot pain. But I feel like obesity is kind of a vicious cycle because you want to work out and you want to get the obesity under control, but then maybe your foot, leg hurts. Then you don't want to work out, so then it just kind of keeps going back in a circle.
Well, it can be that way, but I think the key thing is to empower your patients and try to selectively determine, what's the blockade that's preventing them from doing their fitness. And there are many different ways you can work through injections or some oral anti-inflammatories to reduce the level of discomfort. If a patient, for example, can lose 4 pounds, that'll take 16 pounds off that knee.
Oh, wow.
So it's a multiple, not just pound for pound in terms of the benefit is, say they had knee pain, hip pain, ankle pain. And lots of activities can be done to help limit some of the stress and strain to the joint, such as water aerobics or swimming or a recumbent bicycle as opposed to a harder impact activity like a running activity. So again, it has to be individualized to the patient's needs. And again, that's one of the things we stress at the CAO is that we want to preserve and protect that physician-patient relationship and be able to provide the patients with the individualized care that they require.
And now with our kids going back to school, we've been talking about the sports injuries all day. We've got 10 tips for preventing those sports injuries. We're going to put them up on the screen, but I do want to touch on a few of them. And we've kind of talked about it, but I think kind of reinforcing the cross-training. You may have a baseball player, but they need to cross-train in a different way, a different sport, to keep those muscles working properly.
I think that's essential. So there's 2 ways that I think we need to view and look at cross-training for our patients. And so one way is a patient says, well, look, I need to have better endurance. Well, that's cardiovascular fitness. And so one can get endurance and cardiovascular fitness with running, with cycling, with swimming. And so if you're not always doing the same activity, the continuous single abuse of force of just one of those is now dissipated in different ways with the 3 of them. The other thing that I think is really healthy is a lot of kids, unfortunately, are forced to select and choose a sport early on.
Right.
If you're really committed, you're going to stay with this team. And I think they should play a variety of different sports because different sports work different muscle groups. And so if you've got somebody who's a fall athlete but isn't a spring athlete, maybe doing something completely different in the spring would actually be very advantageous. This idea that you're kind of always doing something, but you're varying it rather than, oh, I took the summer off, now it's football season, here I am, and we're going right at it, and I'm going to crash and burn because I haven't really been doing anything.
Dr. Roussel, just about 30 seconds left, but if a parent notices something you had mentioned before with the limping, what's the first course of action they should take if they notice something's off about their kid to make sure they don't aggravate that injury?
I tell patients just to bring them in and get evaluated. So, at the Centers for Advanced Orthopedics, we have multiple disciplines, orthopedic surgeons and lots of other doctors that can help patients. And we like to get them in, get them evaluated, get them to the people they need to see. Sometimes parents will apologize for bringing their patient in if they think it's not important, but I tell them there's no problem too small. They should bring them in and get evaluated.
Dr. Guidy, Dr. Roussel, thank you so much. We'll see you tomorrow.